How does surgery affect your workers' compensation case? Can it have an impact on your benefits, and does it make your case take longer? Yes, it can have an impact on your benefits, and yes, it can make your case take longer. If your surgery is causal related and you're out of work following your surgery, generally speaking, you get benefits at the temporary total rate, the maximum rate, 2/3 of your salary, subject to that statutory maximum we've discussed in the past. You get that following your surgery. Now, again, depending on what type of injuries you have, how the permanency status of your case is going to play out over time, whether it's a schedule loss case or a non-schedule loss case, that money that you receive following your surgery could be recouped by the carrier in the form of a credit down the road, or sometimes it's not. So it really depends. But generally speaking, if your surgery is causal related, the time that you miss from work following your surgery is compensable lost time, and you do get money for that. The circumstances where that doesn't happen, if the judge had directed a work search and you failed to do an appropriate work search, it is possible that your benefits won't pick up following the surgery. Because if you were not attached to the labor market before your surgery, then you go and have surgery, and now you really aren't looking for work, then you're not going to be found to be attached after the surgery while you're laying at home recovering. So until you actually go back and pound the pavement and look for work, will your benefits start up again. Does it make your case take longer? Generally speaking, again, yes, it does. For the most basic reason, it kind of restarts the clock on permanency. Looking at an elbow or knee case, a very basic case here, according to the Workers' Compensation Board guidelines for determining schedule loss of use for a shoulder, an elbow, a knee, an ankle, the guidelines say that the doctor should be making those assessments 1 year following your date of accident or date of surgery, because they want to give you almost a year to heal, get better, get to the point of maximum medical improvement, get as good as you can get. So having an accident and then having surgery 2 months later kind of resets that clock. So yeah, generally your case does drag out a little bit longer, but it shouldn't really be a consideration as to whether or not you're having surgery, whether you should have surgery. Surgery is there to help you, and that's a concept we need to kind of keep in the back of our mind. Can the need for surgery increase the value of your workers' compensation case, and can it increase the value of your settlement? Yes and no. The need for surgery can certainly increase the value of your settlement, but it can also work in the other direction. Why is that? Surgery is there to make you better. It's there to help you. And as we know in the workers' compensation world, at least here in New York State, a major component to a lot of settlements is your level of permanent disability. Surgery is supposed to make you better. It's supposed to get you back to work. It's supposed to reduce the level of your overall permanent disability. And I get this question all the time. I had 6 surgeries on my back. What's that worth? Well, just because you had surgery on your back doesn't mean it's worth anything at all. Presumably, if you had 6 surgeries, you were in pretty bad shape, but they opened you up 6 times to make you all better, and you're 100% okay, and you're good to go. Here in New York State, we don't award benefits for pain and suffering, loss of enjoyment of life, punitive damages. So just the fact that you went through 6 surgeries and the suffering that entails doesn't automatically result in more money. So that being said, need for surgery doesn't necessarily mean you had the surgery yet. And sometimes in certain circumstances, when it comes time to settle a case, maybe you need surgery. Maybe your doctor went and did arthroscopic knee surgery and a Synvisc injection. A Synvisc injection is when they inject a gel into your knee joint, and it provides a cushiony lubricant within the joint. It's supposed to reduce your symptoms, make you feel a little bit better. So sometimes people who have those types of treatments might need a knee replacement down the road. And maybe we're at the point in time now where maximum medical improvement has been found, and there's not much else to help you here, but you might need knee replacement in 5 or 10 years. If that's all documented and that's there, that need for surgery, like we're discussing here, does have value. And if you want to settle your case, your lawyer or you could go to the insurance company and say, look, I'm going to need a total knee replacement in 10 years. What's the value on that? How much is the total knee replacement worth today? It's only going to go up with inflation. That number is going to come back down with present dollar value, but we need to figure out what the value is here so that perhaps I can pay for my own surgery down the road if I choose to go ahead and have the surgery and pay for it myself. What's the key to getting surgery approved in your workers' compensation case, and what are some things the insurance company might do to prevent that from happening? The biggest key to getting your surgery authorized is having a doctor who understands how workers' compensation works. New York State Workers' Compensation Board has established the portal system, an online system where the doctors enter their reports, enter their requests for authorization for particular treatments and surgeries, and having a doctor who understands that system, how to follow that system, and how to apply his recommendations and requests properly is what gets you the best results. Workers' compensation in New York State has what's known as medical treatment guidelines. It's a book, it's a checklist. If you go see your doctor and you say, well, doctor, my shoulder hurts, and you explain that it happened at work, and you tell him what happened, and he diagnoses a torn labrum, the doctor's supposed to turn to the torn labrum page of the shoulder book and follow the guidelines and conduct treatment according to the guidelines. And if the doctor chooses to vary from those guidelines, he has to request a variance. And how does he do that? He goes into the portal and he has to to follow the instructions and make sure he enters his recommendations properly and his requests properly and get the authorization that he needs to get your surgery authorized. So having a doctor who understands the system and knows how to request treatment properly is the biggest tip, is the biggest key to getting your surgery authorized. And unfortunately, lawyers have been kind of taken out of that equation a great deal. We used to have a lot more control in getting things authorized, but now it really goes through that portal system and we have less power to get things authorized. What are some of the things that the insurance company might do to prevent getting your surgery authorized? A big one is finding out if you have pre-existing conditions and attributing the need for surgery to those pre-existing conditions. So if you tore your labrum, torn rotator cuff, they're going to want to ask you, did you ever have a problem in the past? And we've discussed this in the past about fraud allegations. Let them know, because you need to be open and honest with them, but they might try to blame it on that. But just because you had an old injury from when you were a running back at Polk High in Chicago doesn't necessarily mean that they're going to win on that. Maybe you prove to them that you've been working for the last 25 years, you never took a day off for a shoulder injury. Just because you heard it 40 years ago doesn't necessarily mean that that's solely due to that. So, there are arguments to be made and you can get past it. And you'll want to make sure that you do that rather than getting stuck behind it and not disclosing it, because now you're just looking like a liar. We don't want that. Other reasons, other things the insurance company might do to deny your surgery. One big one that we see is the doctor didn't provide enough conservative care. The medical treatment guidelines that we're discussing might say that you need to give 6 weeks of physical therapy and an injection before you move on to surgery. The doctor didn't provide any documentation that enough physical therapy was given. And this is where it's important to have a doctor who understands the system, who knows that you have to document everything so that they can't deny your surgery based upon reasons like that. No documentation of objective improvement is another one. The doctor's got to show that the treatment he's given you up until that point has helped you to whatever point, and all of your treatment and your improvements from that treatment are documented. Regardless of whatever the reason for denial is, the insurance company has to provide the doctor with that reason. They can't just say denied and rubber stamp it and move on. They explain their reason for denial and they give that denial back to the doctor. And the doctor has that reason, which he should use in making the next request if necessary, so the case can move on and you can get your authorization. And if anybody has any questions about workers' compensation, I do New York Workers' Compensation. Feel free to give me a call, 212-406-8989. We will always be here to help you out. I was supposed to get a surgery and I decided not to do it. Can I still settle it, or I still have to go through the procedure to get the case settled first? That lowers the value of the case. No, you can't be forced to undergo surgery. If you want to have surgery, if you and your doctor agree that's the right thing to do, if it's authorized, approved, and you want to do it, go for it. But listen, some people are just deathly afraid of surgery and they don't want to do it. I've had clients come in here that have relatively minor findings on their diagnostics. Their MRIs don't show huge injuries, that say the doctor has said that surgery might help me, and they will stop at nothing to get their surgery authorized. And I've had people that are in here with arms and legs held on with thread that look like they've been through a war. I'm not a doctor, but I know that this person needs surgery. And they said, I don't care how bad my doctor says I need surgery, I'm not having surgery. There are people that won't have surgery due to religious reasons. So no one can force you to have surgery. If your surgery doesn't get authorized, if you choose not to have surgery, whatever, you can move on with your case. We've had many cases where a person has been recommended for surgery. They say, I'm not having it, or I'm not having it now. I might have it in 3 or 5 years from now, but I'm not doing it today. You can wrap that case up sometimes, settle it, be done with it, and potentially reopen it if necessary. What can you do if surgery is denied by the workers' compensation insurance company? What are your best options for getting the treatment that you need? Again, we're going back to what I said before. Having a doctor that is knowledgeable not only of your injury and the treatment that's needed and what can be done to make you as good as possible, but knowledge and understanding of the workers' compensation system. It's a quirky system. Having a doctor that knows what they're doing is huge. It makes everyone's life easier. They get surgeries authorized quicker and easier than doctors who don't know what they're doing. They know what's going on. It speeds up the time to get the treatment and the surgery that you need to get better and get back to work. It shortens the length of your case. It shortens the length of the tough time in your life. It makes my job easier. Surgeries get authorized. People move on. Cases get processed and pushed through. There's less complaining, less problems. Having a doctor that knows what they're doing is monumentally huge and helpful. It's the number one thing that's going to make your life easier and better in the long run. So make sure your doctor knows the workers' compensation system. Do you choose your doctor when getting surgery in your workers' compensation case, and how can you make sure you choose the right one? Here in New York State, you are free to choose your treating doctor for your treatment in your workers' compensation case. You get to choose your doctor, and as long as your doctor accepts you, then you're good to go. And how can you make sure you choose the right one? Talk to people. If you have a lawyer, talk to your lawyer. If you're treating with a doctor now and you're not a big fan, talk to your lawyer. Maybe they can help you. If there's a doctor you know and trust that doesn't take workers' compensation, but they've been your family physician for 1,000 years, go talk to them. Everyone's here to help. Talk to friends and family who've had workers' compensation claims, people that have been through the system before and know what's to come and give you some expectations. Do some Google searches. Everything gets reviewed. Check the doctor's reviews. On the Workers' Compensation Board website, there is a section where you can search for a doctor, and you can search for them by specialty and by zip code. So you put in the specialty you're looking for, you put in the zip code, and they'll give you a list of doctors that are in your area. The board is doing its best to keep that list up to date. There's a lot of people that chastise the board and they say, oh, these doctors aren't even, this guy's dead and this guy retired 30 years ago. Listen, it's a very difficult list to keep up to date with all the things that the board does do. It's a tool to help you. They're not Mother Goose, and it's not their job to make sure that you get to a doctor. It's your job. But it is a very helpful tool. We use it all the time, and it's nice that they even do it. What should injured workers consider before deciding whether or not to get surgery? What questions do they need to ask themselves? You need to talk to your doctors about the expected outcomes, the pros and cons. If you don't understand what your doctor's explaining, ask more questions. Even if you do understand, ask more questions. People come in here all the time, sure as hell, that their doctor said that they want to do surgery, but it's probably not even going to help. And my doctor said I'm going to become paralyzed. I'm pretty certain your doctor didn't say that. Surgery is there to help you, and a doctor's not going to request surgery that's going to make you paralyzed, and they're not going to request surgery that is going to kill you. Does it happen? The doctor's required to give you the full spectrum of what could and could not happen, so you have a full understanding. I've never seen it. Talk to your doctors. Get a good understanding of what that surgery entails, what they're going to do. I like to understand the mechanics of it. Doc, you're going to go in there and you're going to do this and this and this. What's the purpose? Let them explain exactly what the surgery is. It'll make sense. And this way you can make an informed decision. Doctor, what should I expect with this surgery? The same way we have the people that come in and say, I'm going to become paralyzed or I can die from the surgery. We have the people that think, I'm going to be able to go climb Mount Everest tomorrow. You need to be reasonable in your expectation. How much function can you expect to regain by a particular surgery? How much movement? How much strength? Talk to your doctor about those things so you can be reasonable. The same reason why we settle cases for known amounts of money, so you know what you're getting. Surgery is the same thing. Know what you're getting so you can plan and move forward. But again, if you have any other questions, you can always give us a call, 212-406-8989. Thank you, folks, and have a wonderful rest of your day.